Hi guys, and welcome back to this journey towards excellent exam results. In these shorter revision videos, we are going to be breaking down different concepts within the GCSE Geography specification. The aim of this is to help us understand the concepts better and to give us the information and confidence we need to answer examination questions. In today's video, we are going to be talking about demographic indicators of development and population pyramids. This information is relevant for the development unit in all the GCSE geography specifications. Okay, let's get started. On this slide, we have two population pyramids. Sometimes they're also referred to as population structures, but I think that for our specification, the examiners would like us to use the term population pyramid. So the population pyramid of a country can help us determine whether that country is developed or not. In other words, it will give us an idea of whether that particular country is developed or not. Now, when talking about population in a country, there are certain terms that we need to know the meaning of. So the main terms here include birth rate, which is the number of live births per 1,000 in the population of a country per year. And then the death rate is the number of deaths per 1,000 people in a country per year. Then we also have the life expectancy, which is how long someone in a country can expect to live, to live for. And this obviously gives us an indication as to how good the healthcare in a country is. If the healthcare, the quality of healthcare and the provision of it is good, then people can expect to live longer and vice versa. Then we have infant mortality. Now, infant mortality is the number of children per 1,000 births that die before the age of 1. Now, that obviously will give you an indication as to the development level of a country. If the infant mortality is high, then it will mean obviously that the country is not as well developed because their medical care and infrastructure may not be as developed as well. Then we have fertility rates. These are the average number of births per woman. And then maternal mortality is the number of mothers per 100,000 who die in childbirth. Then we also have dependency ratio, which is the last key term we'll be talking about. And this refers to the number of people between the age of 0 to 14 and those that are over 65, the age of 65, compared to those who work. Now, what does that mean then? So it means that it's the number of people that rely on the economically active or the working population. So they are dependents. So 0 to 14 obviously are people who are, people who are not yet at the age where they can work. So they are likely to be of school-going age, for example, and they rely on their parents, so they're dependents. And then the ones who are over 65 are likely to be retired and therefore are considered to be dependent on the economically active, because the economically active will be paying taxes, and those taxes obviously are going to be going into the pension pots that will be supporting them. So the dependency ratios here, if high, can then mean that out of the GDP that is coming to the country and to the government, a lot of that money is going to the dependents, which is not necessarily a good thing. Now, coming back to the population pyramids that we have here. Now, the top population pyramid there is one for Malawi, and the one at the bottom is one for the United Kingdom. And we can obviously see some differences between the two, and those will obviously indicate to us whether a country is developed or not. If we look at the one for Malawi, it has a very wide base here at the bottom. Now that implies that Malawi has a high birth rate, and countries that have a high birth rate are likely to be countries that are not as well developed. So these are LICs, or low income countries. And high birth rates could imply that in the country people do not have access to contraception, for example, and that could indicate that that country is poor. If we compare that to the population pyramid for the UK, you can see that at the bottom of this particular population pyramid, the birth rate is a lot lower. Okay, and then going back to Malawi, if we look at the top of the population pyramid, it narrows down quite a bit. Okay, so that indicates to us that the life expectancy in Malawi is a lot lower than the life expectancy we have here for the UK. The UK decreases a lot more gradually and not as fast. So meaning that the life expectancy in the UK is a lot higher. Now that indicates to us that the UK is likely to have better healthcare provision and better infrastructure in terms of healthcare, better more doctors per person and so on, and therefore it's a developed country, because for you to have good healthcare and healthcare provision, you'd have to be a country that is economically able to do so. You have the money to do so. Then finally, we can have a look at the steps that are between the different age groups here in Malawi, and we can see that some of them are very big steps, which indicates that the death rates are likely to be fairly high in Malawi. So from very high birth rates, and then the death rates, people, the large steps here are showing that a lot of people die as well. That obviously again is indicating that in terms of healthcare provision, Malawi may not have as good a healthcare provision as the UK, where that is not necessarily the case, because here in the UK it looks like the number of middle-aged people that we have here is a lot more than we do in Malawi. So these two population pyramids, if we were to find them in an exam, we should be able to distinguish which one is showing us a low-income country and which one is showing us a high-income country. That brings us to the end of this video on development indicators. I hope that you have found the information insightful and useful. I have also done a video on how development is measured. It will be linked in the description below and will also pop up as a suggested video at the end of this one. Thanks once again for joining in this journey towards excellent exam results. All the best and see you again soon. Bye-bye.